I thought I was too old to have a baby.
Can you actually have a healthy baby after 40? The short answer is yes. But the biology of how it happens, and the specific risks for both mothers and fathers, is rarely explained clearly. Let's take a closer look. Let's start with female fertility. Most people know that fertility declines with age, but what's actually changing inside the ovaries? Before a baby girl is even born, her ovaries contain several million immature eggs. But that number begins declining long before birth. By the time she reaches puberty, only about 300,000 to 500,000 remain. As the years pass, that reserve continues to shrink. By age 37, the average woman has roughly 25,000 eggs left. By menopause, only around 1,000 remain. But fertility isn't just a numbers game. The quality of eggs changes with age as well. Older eggs are more likely to contain chromosomal abnormalities, which can make conception more difficult and increase the risk that a pregnancy ends in miscarriage. In fact, age-related changes in egg quality are considered one of the main reasons fertility declines after the mid-30s. As a result, the chances of becoming pregnant gradually decline over time. By age 40, the average chance of conception in any given menstrual cycle is typically around 5 to 10%, compared with roughly 20 to 25% for women in their 20s and early 30s. Of course, fertility varies from person to person. Some women conceive naturally in their 40s without difficulty, while others may face challenges much earlier. Most people know that female fertility declines with age, but fewer realize that male fertility changes too. While men can remain fertile well into later life, age can still affect both the chances of conception and certain pregnancy outcomes. Unlike women, who are born with all the eggs they will ever have, men continue producing new sperm throughout their lives. As men get older, sperm quality tends to decline. Sperm count, motility, how well sperm swim, morphology, their shape, and DNA integrity can all gradually worsen over time. As a result, conception may take longer. Studies have found that couples in which the male partner is over 45 are more likely to take a year or longer to achieve pregnancy compared with younger couples. Delayed fatherhood, often defined as age 40 or older, has also been associated with a higher risk of miscarriage and a slightly increased risk of certain pregnancy complications, including preterm birth and low birth weight. Researchers have also observed that, as men age, new genetic mutations accumulate in sperm cells. Because of this, children of older fathers have a modestly increased risk of certain neurodevelopmental and psychiatric conditions, including autism spectrum disorder, ADHD, schizophrenia, and bipolar disorder. However, it's important to keep these findings in perspective. While the relative risks increase with paternal age, the absolute risk for any individual child remains low, and the vast majority of older fathers have healthy children. If pregnancy does occur after 40, it usually requires closer medical monitoring for both the mother and the baby. For the mother, certain complications become more common with age, including gestational diabetes, preeclampsia, placenta previa, and a higher likelihood of cesarean delivery. Multiple pregnancies, such as twins or triplets, are also more common in older mothers, particularly when fertility treatments are used. While many twin pregnancies are healthy, carrying more than one baby can increase the risk of pregnancy complications. For the baby, the chance of chromosomal conditions increases as well. The most well-known example is Down syndrome. At age 25, the risk is roughly 1 in 1,200. By age 40, it rises to about 1 in 100. However, statistics tell only part of the story. The majority of pregnancies after 40 result in healthy babies. A healthy lifestyle and early care make a huge difference. The conversation about parenting after 40 isn't only about risk. Research also suggests several potential advantages. Older parents are more likely to have financial stability, established careers, and more life experience when entering parenthood. In many cases, pregnancies at this age are also more planned and carefully prepared for. There has even been research exploring possible long-term health associations for mothers who give birth later in life, including links to healthy aging outcomes. However, these findings are still being studied and are not fully understood. Becoming a parent after 40 is a personal decision balancing joy, risks, and readiness. Consult trusted doctors. Weigh your health and values, and remember, there's no perfect age, only the right one for you.